Hey everybody, it's Dr. Hammerset from Holist, and I am really stoked to bring on Spark MD's Dr. Julie Gunther. First, I'm going to just explain my camping hair. I had an awesome Memorial Day weekend up in the wilderness in northern Idaho with no cell service, which was amazing, and lots of dirty kids and dirty adults and rivers and woods and all sorts of stuff. So just arriving back into Boise and really excited to have Dr. Julie Gunther on here. I hope everybody else had the opportunity this weekend to form some new memories, get some time away from work, hopefully, and to remember those that have served and lost their lives doing so. So today we are going to talk about the direct primary care model. And let's see, Dr. Julie Gunther, and she is from Spark MD. She's a family medicine physician in Boise, Idaho, and a national leader in the realm of identifying novel ways to help patients access affordable care and find a way back for physicians into physician wellness and autonomy. And she has been published on Kevin MD and is a national speaker on the direct primary care model. Hi there.
Hi.
So glad you made it. Fifth time's a charm.
Oh my goodness. Yeah, thank you for having me.
Yeah, thank you. So I was just introducing you a little bit, talking about Spark MD and how I'm just really excited to have you on here to talk about this really unique and hopefully growing way of practicing medicine. And first of all, why don't you just introduce yourself and kind of frame for us what the issue is that kind of made you look out for this new model of delivery?
Yeah, well, thank you. So I'm Dr. Julie Gunther, and I'm a board-certified family physician. I grew up in Boise, Idaho, and I finished residency in 2009. After I finished residency, I worked as an employed outpatient physician for about 5 years. And for innumerable reasons, started to really feel like I couldn't continue to function in that model. There's lots of specific reasons. But when an administrator tells you that you'd probably be better off owning your own clinic, you'd probably be better off owning your own clinic.
Yeah.
So I was really looking for a way to regain some autonomy and to just kind of, one thing I say, take back healthcare. So what I mean by that is, I should say, take back doctoring. So a huge chunk of my day was not spent doing what I trained to do, which was to take care of people. It was spent taking care of codes and paperwork.
Right.
So I was looking at all kinds of things. I was looking at opening a franchise of urgent cares. I was looking at leaving healthcare. I looked at medical writing, all kinds of things. And then in 2013, I had the privilege of meeting two physicians that were doing direct primary care. And it was sort of like all the pieces connected for me.
Awesome. That's great. I've been thinking about our healthcare system in terms of layers recently, just sort of like all the layers that are between the physician and the patient, and how that really, I think, is, a lot of the reason why we're unwell as physicians, but it's also why our patients don't feel connected to us. They don't trust us. We haven't been advocating for ourselves very well. And so, this direct primary care model is a really interesting one. So why don't you tell us a little bit about how it works?
So direct primary care, the hardest part of direct primary care is that it's so simple, it hurts, I guess I would say. And there's a lot of us joke about the head tilt. So when we're describing this model to accountants, bankers, friends, other physicians, it's the simplest form of trade. So I have a service that I provide, and that is primary care, or being a normal physician that takes care of most family physicians. Depending on their training, can take care of most things most of the time. So about 80% of our healthcare utilization is a primary care issue. So I do that. I'm a doctor, sort of like a old country doctor, but in the city, and people pay me money. And that's literally what it is.
Yep.
Excuse me. What's hard for people to grasp is, so in that transaction, there's no insurance billing, which means there's no coding. And that's sort of where people's head starts to hurt a little bit. Just the completely simple notion that they pay me and I take care of them.
Yeah.
My model is a monthly fee.
Okay.
So I don't charge when people are seen. There's no visit fee. The phrase copay is an insurance phrase, so we don't use that too much. But patients pay, I say, less than a cup of coffee a day. Depends where you go. Less than a cup of coffee at Starbucks a day for sure. Maybe a little more than a cup of coffee at Denny's. And then I'm their doctor, and I'm available to them almost all the time when they need me.
Yeah. So how are you able to kind of keep your costs down to do this affordably for patients?
So the super big epiphany to me and to a lot of other physicians particularly is actually how cheap most things are, particularly in primary care. So a CBC is $1.25. A Z-Pak is $2. Actually, a CBC in our market's a little more than that. It's about $3. Physicians in Idaho and a number of other states can dispense directly to their patients, and that really benefits rural physicians, but it also benefits insured and uninsured patients because if you buy medications wholesale, particularly generic, well, mostly generic medications, the cost is 10% of what a patient could normally probably spend. That includes the Walmart list, that includes the GoodRx prices. So Consumer Reports just did a big analysis of how to save money on drugs, and they left direct primary care out of the equation, and they had a list of 5 or 6 meds, and I think the cheapest they got it to was $66 a month. Those same 5 or 6 drugs were $22 at wholesale price. So we, direct primary care physicians, and I, in my market, where I live, was one of the first ones here. So we just negotiate with everybody, and cash is king. Cash simplifies the transaction for everyone in every business model, and healthcare is no exception. So if someone can have a guaranteed payment at the time of service, whether that's an imaging center or a lab or a pharmacy, they're willing to lower their prices also because it makes their business model work better. And then from there, most of what I need, have, or do is really cheap. Like lidocaine, super cheap. Liquid nitrogen is $2.50 a liter. So freezing a wart and charging $183 when your materials are less than $2 doesn't make sense to me.
Yeah.
And I know that, there's time and knowledge and things like that. But so the dirty secret, so to speak, is the majority of the things a primary care physician would need to provide great primary care are super cheap.
Yeah. And removing those layers, right, in between you and your, whoever you're buying those services and products from, is really great. So how do you think that this model helps create better lives for physicians? Because I can obviously see how it's going to create better lives for patients, right? They have more access to you, they know you, they trust you, they can afford it, right? But so tell us about kind of how it's changed your life, or how you think that physician wellness would improve with this.
Right. Well, and I would be remiss not to say one criticism that's starting to arise of the direct primary care movement is those of us that have been doing it a while talk a lot about how it helps physicians. And so I'm glad you pointed that out. It really does help patients and a tremendous amount. And that's one of the reasons to do it. But we have a mental health crisis in our physician professional community. So for me, the simplest answer is that the things that drove me to be successful in physician training and that drove me to want to be a comprehensively trained primary care physician, the sort of secret ingredient is autonomy. And in an employed model, when I lost autonomy, it really altered the transactional relationship with the patient. And by that, I mean, no matter how compassionate I felt or how hard I worked or what happened behind the scenes, patients don't see it. And there's so many barriers in the transaction, so to speak, that it doesn't feel therapeutic. And so both physicians and patients are sort of on the raw end of the deal, so to speak, in that by the time we get together, it's just this an antagonistic, truncated, untherapeutic thing mutually.
Mm-hmm.
I said the other day, I was a very good doctor in the system, and I'm a great doctor now. And my clinical knowledge didn't change,
right?
But my ability to spend time and listen, and for people's ability to see the work I do, it pays incredible dividends to have people realize what we do. And when so much happens behind the scenes, or when people have to act like crazy people to even get a visit, it doesn't reinforce that we care or that we want to take care of them, or it just the whole primary care relationship breaks down. So the restoration of autonomy to me has been what's the best for my mental health, and the ability to practice really authentically. So to say, like, I had a patient in last week, it was unexpected. She had some complications, walked in, needed to be seen. I prefer to not do walk-ins, but every once in a while that happens. And so the patient after her really wasn't accommodated properly. But we were able to, apologize and buy her a coffee and say, hey, here's the time tomorrow. You can either wait another however long this is going to take or come back tomorrow. And people are really decent when you're decent to them.
Right.
Most of the time. So the whole thing is is better. You start to feel like a human being and a part of your own community.
Yeah. I have a toddler joining us here apparently.
Okay. Hello.
So, I mean, I think too, is that like the opportunity to really get to the reason why someone is visiting your office takes time, right? I mean, it takes time to get in there and find out really what it is that somebody needs and wants to be able to provide what they actually need, right? You know, if you don't know what they're expecting, you can't help. So that's awesome. So 3 things you wish all patients knew. Give us 3 things.
About direct primary care or just in general?
Oh, whatever you want.
And what? So the first thing I wish everybody knew is that physicians are humans and we work so hard. And most physicians really are great people who've worked really hard and have incredible compassion. And I think if we started through that lens, normal people, non-physician people would start to realize just how problematic our system has become for the people who want to provide care. So I wish people knew that we're normal people. Yeah. I wish people socially, I wish people, including our own parents, wish people understood what kind of stress we're under because of the burden of debt. So this generation of physicians, I would say physicians in their 50s or under, are just drowning, right, in debt. And it's not sort of a champagne problem. It's not sort of like, oh, that doctor's out there making $400K. What are they whining about? It's, right. You know, primary care physicians aren't in a position to save for their children to go to college or for retirement. So that's a catastrophic problem socially, and it also leads to burnout. Yeah. And then I wish that physicians understood how dehumanizing it is to be a patient in a system. And I was diagnosed with breast cancer 2 years ago, and I joke that like I did everything I possibly could to get out of the employed model. And then, so since I wouldn't go back as a professional, I got thrown back in as a patient. Yeah. And it's really, really hard to feel safe. And it's really, really hard to trust that your physician's got it. You know what I mean? Yeah. Like they're going to take good care of you when administratively the hurdles you have to jump as a patient are so duplicative, and anyway, you just start to feel terrified that someone's going to hurt you because everyone's paying so much attention to, you know, your date of birth. Right. But no one's really paying attention to you. Right. Yeah. You know, I think that when I became a mother, I became a better doctor for a lot of reasons, but part of it was just having to go through the process of being a patient. Right. And that's what you're talking about here too. So absolutely. So, all right. So tell us where we can follow you online and where people can find you in person. So I live in Boise, Idaho, and our clinic, Spark MD, is downtown, right by Flying M in St. Luke's. But online, we are at www.sparkmd.com. And for physicians and physicians who are interested in direct primary care, I've been trying to get something off the ground for about 2 years, and it will be launched next month, and it's called The Doctor Project. Awesome. Yeah, it's called The Doctor Project, and it's about all this and how to go out on your own. And so those are the places that you can find me. Terrific. So thank you, everybody, for watching, and to Dr. Julie Gunther for joining us today here at Holist. I'm really looking forward to strong-arming her into being a Holist network physician so we can add value to our clients and our patients' care through coordination and cooperation aimed towards a team-based comprehensive health and wellness. And as always, I'm Dr. Hammerstedt from Holist, and thanks for tuning in. And you can find us here at Holist Health on all the social media platforms and at www.holisthealth.com. And I'm in the middle of a ton of content work on a new and revamped and awesome premium weight wellness coaching program with a new content, new delivery system, new website, new personal weight coaches, and the addition of mindset coaches, which is really exciting. And so it takes commitment, but we definitely have the tools to do that kind of mind-body transformation in 2018. So join us. And Dr. Julie and I will talk offline another time about dragging her into the network. So yeah, thank you so much. Yeah, thanks so much for coming. Thanks for your work. Hope everyone has a terrific day, and we will see you all soon. Happy Medical Monday. Okay. Bye. Yep. Bye.